Guys, this is Kiro, and the topic that I'm going to go over today is proprioception and how it's affected by diabetic peripheral neuropathy. They are a little bit interrelated, and definitely, proprioception is affected by peripheral neuropathy. So, just wanted to go a little bit over that. The main purpose and the objective of this PowerPoint and this presentation is to explain how proprioception is diminished um, due to diabetic peripheral neuropathy. We'll go into a little bit of how it happens, um, how it can be treated a little bit, uh, and what we can do and what we see with patients that develop this peripheral neuropathy due to being diabetic. So this so what is proprioception? Just kind of go over a little bit of what it is. And proprioception is the body's ability to know where it is in space at any given moment. So there's multiple factors that play into this. One is just the visualization and the visual stimuli you get from your eyes. The vestibular system is definitely helps with balance and knowing where the body is in space. And then there's also kinesthesia, which is more so knowing where the body is in motion, not necessarily as cognitive as proprioception. And then there's proprioception that more so is based on receptors throughout the entire body. And this is kind of what you think of walking in a dark room and not being able to see anything. Fair, most people, for the most part, if there's nothing in the way, can walk across the room even if they can't see anything, and can get across the room fairly easily. Um, and this is just from all of these playing into each other's roles and just assisting and getting signals to the brain of, hey, this is where I am in space. This is how I need to stay balanced, and kind of go on that route. So how does this work? So when you think of the body, you think of all the muscles that go along with it. You have, well, one, throughout the entire body, you have receptors such as mechanoreceptors and thermoreceptors that assist a little bit in kind of knowing where you are with the mechanoreceptors. And then you have these proprioceptors that are in mostly in muscles, um, and they're these little protein spindles. And what these are is they're sensitive to stretch. So if they're shortened or elongated, that is what they will typically use as a stimuli. Um, and these spindles are in all muscles all across the body. So when you think about just how many muscles are in the body in general, thing is there's quite a bit of these receptors throughout the body. And once these spindles are, like I said, elongated or shortened, um, they in turn send a signal to the brain of, hey, this muscle is active, this muscle is being used to stabilize, this muscle um, is being elongated, shortened, whatever it may be, and will send signals to the brain telling it where it is or what's going on so that the body knows where it is in space. Um, so when you think of peripheral neuropathy and diabetics, peripheral neuropathy in general is so it's numbness, tingling, pain, or loss of sensation, or whatever it may be, due to nerve damage. Um, this is typically seen in the hands and feet since it is peripheral. Um, so usually in the fingertips, on the bottoms of the feet, things like that. And typically in diabetics, the main cause of this is due to vascular changes in the affected area. Usually, atherosclerosis develops in the affected area, which leads to poor circulation, and with that, the nerves that are innervating that area are also they become damaged, which will lead to the neuropathy. Um, in diabetics, the most common form of neuropathy in these patients is symmetric distal sensory neuropathy. Um, and with this, both large and small nerves can be affected and damaged. When you think about the smaller nerves that are damaged, this will typically to a loss of pain sensation to thermal sensation, which affects those limbs, and then when you think of the larger nerve fibers that are lost or that are damaged, sorry, this will lead to a loss of touch and a loss of vibration perception, and that's typically um, the biggest factor in what affects proprioception and the body's ability um, to feel out where it is. So when you think about just these receptors that are on the bottoms of your feet, for instance, or on the muscle in those areas, if those are not signaling properly, then we definitely have a little bit of a problem there. So how does this affect proprioception? So like I was saying, you have these receptors all throughout the body, and especially and then you have the spindles throughout the muscles. And what we see is if these are not signaling properly, um, one, the body or the brain does not know um, where the body is landing. For instance, if someone is standing on an uneven surface, but those receptors in their feet are not sending signals to the brain that, hey, I'm on an uneven surface, uh, that's when we get a loss of balance, a loss of just stability. For the most part, when someone is standing on flat ground, they can maintain balance because the vestibular system is still working properly. The person is still getting visual stimuli that is telling the brain where it is and where the person is. However, when that person is walking or if their eyes are closed, things like that, that is the main areas of where we see just difficulty. Um, and like I was saying, so if someone say rather than walking on cement, if this person is walking on grass, now because this is an uneven surface and the receptors are not functioning properly, then they have a higher risk of uh, losing balance, falling, getting injuring themselves even further. So that's kind of where we see the effect of um, the neuropathy having a detriment on the proprioception. So how do we fix this? So currently there's not a specific treatment um, for this peripheral neuropathy. The best thing that we can do at this time is slow down the rate in which it progresses. Um, if someone is caught early on with this, what a person they can do balance exercises, whether their eyes are with eyes open or closed. I mean, if they're able to do with closed eyes, um, that would be ideal, just because that removes any visual stimulus that the person is getting. Um, so it really, really relies on those receptors within those spindles to allow the body to kind of activate those a little bit more and rely on them a little bit more, so they're used to functioning at a much higher rate. When someone has some signs and symptoms of neuropathy and they go to the doctor, they will typically get tested with a tuning fork. And what this does is will put a vibration to a specific area, and the doctor will see if there's any sensation that's happening there. Other things that, like medications can be prescribed to reduce pain. If a person is having the neuropathy in their feet, um, then sometimes they'll get sent to a podiatrist to get special footwear. And if left untreated, then the numbness, tingling, and other symptoms of the neuropathy can become worse over time. Um, so yeah, that's just kind of a little bit of what I went over, and then here's some of the articles that I gathered information from, and some couple of questions that I have. First one is peripheral neuropathy is a condition that can be treated and reversed if treated with A, medication, B, muscular re-education, 3, balance training, 4, peripheral neuropathy has no treatment, and then 2, proprioception is the body's ability to regulate temperature in the body. So yeah, thanks for listening, and hope this was informational.